Hi, and welcome to The Way to Wellness. I'm Dr. Sean Polana, DC, and this week we're focusing on the serious effects of auto accidents. If you read through my article, you see I addressed the situation of a patient who was in a serious auto accident. They were hit from behind, they were still, and someone hit them from behind going 65 miles an hour. They never addressed that they had problems, and 10 years later they figured out that the cause of their depression, anxiety, chronic pain, disc disease, and osteoarthritis stemmed all from that original accident. And that is a very common thing in my practice. At least 50% of my patients have old issues that they never tied back to the original accident. So that's what we're here to talk about today. We're going to briefly go down 10 points of what to do if you see a car coming and you can't get out of the way and you know the impact is coming. There's some basic things you can do to cut your injury and damage in half, at least in your own body. And I'm going to briefly cover them. Number one, you need to look forward. If you're turning to the side and then you're getting hit, this is basically the effect of a 5G force in a half second, 10 times greater than bungee jumping or skydiving. So when you see it coming, don't look at it come on you, look forward. Number two, after the impact, you need to go ahead and assess the situation, make sure that you're okay. But before you even assess the situation, you want to push hard into the brake before that impact. So push as hard, look forward, push as hard as you can. Number three, you want to push back into the seat. So push your back fully back and tense up, because this is going to protect you. You can kind of think, if I were to come up and punch you in the stomach, would you rather tense up and let me do that, or would you rather get it when you're not expecting it? Well, obviously you'd not like to get it either way, but you're going to do better if you're tensing up. The next thing is you're going to go ahead and, after you assess the situation, you want to basically think safety. So the adrenaline's pumping, you might get out of the vehicle. At this time, this is when many fatalities happen. So, be safe. You're not completely protected there on the side of the road. Make sure you're safe, people in your vehicle are safe, get your car off to a safe distance, get to a safe distance. Next thing is call 911. Some people say, well, let's just trade insurances, and or not even that. Maybe just get your information because I don't want to affect my insurance. No, call 911, get it all documented. Next thing is get that pertinent information. And after that, go to the hospital. I don't care if you don't feel anything. Go to the hospital, get x-rays, get an assessment, because days later, once that adrenaline wears off, you can have very serious problems. You can have cerebral problems, you can have arterial problems. So go to the hospital, get it all documented. From there, you need to follow your doctor's orders. And if they say stay home the next day, stay home the next day. After the next 2 to 3 days, very, very important that you're icing, ice, 20 minutes on, an hour off, 20 minutes back on. And then finally, last but not least, go see your chiropractor or trained therapist who has the experience and training to deal with these types of cases. You don't want to get fully racked and cracked. You want to go easy with this. So you need to go to someone who is specifically trained on how to deal with these accidents gently but effectively. Well, that's our 5-minute seminar on the way to wellness. You can catch me each week here, and we'll have tips, quick advice, and practical information to make your life better. I hope you're on the way to wellness. Thanks for joining us.